we want patients to come to a dermatology office, to come to a plastic surgery office, understanding what is possible. And if you see an Instagram post and when you look at it before and after, right, those things are not made overnight. There is a process that goes into that. So we're going to talk about that process.
Yeah. And then being realistic with our patients, because some of those are altered online that you're seeing. Some of those are at different angles. These people are in different clothing. You can see differences in the pictures as a provider versus a patient. You just see the change, but we see the change that they're making you see. So we just want to be able to actually, like I said, break those myths and show you what you can actually have done.
Mm-hmm. There is this one guy out of Brazil, and I follow his Instagram. One of the things that I do love about him is that he will be very honest about the fact that it takes at least 3 or 4 sessions to get to this result, how much filler he's doing on the facial harmonization. It's a lot of syringes.
Yeah.
I was actually really surprised. And I have patients that come to me thinking they're going to get that in one sitting. And I'm very conservative in the way that I approach things and how we build up so that we don't lose your normal face and your aesthetic, and that we build slowly. So I like when I see that. And I want to talk to people honestly about the fact that those people out there that are telling you exactly what they're doing, how long it's taking you to go there, maybe showing those intermediate pictures.
Right.
Those are good people to follow. And I actually have been accused of altering pictures.
Really?
Yes. And I didn't. So I do understand that it's not an exact science.
Right.
In my practice, I rely on my patient care coordinators to take a lot of my before and after pictures. We have a room. It's kind of set the same way, but the camera angles sometimes change. They zoom in and zoom out.
Right.
It's amazing how much it takes an effort to get really consistent before and after. So yeah, the lighting might be off a little bit. So I try to say, those things. So I get it, how sometimes it might look totally altered. But it's, I think, nice to give a little bit of the knowledge of what happened in the process. Because
Correct.
Instead of just seeing snapshots in time. And we're not just going to talk about aesthetic either, because I do a lot of reconstruction.
Right.
And Andy does a lot of medical dermatology treatments too. And
Right.
it's just important to highlight that I think we're both better.
Right.
Because we're in both realms.
Correct. And I crossed both realms because I've worked on the plastic side and the dermatology side. So it's nice to have somebody to actually conversate with that knows a little bit of background on everything else too. And then speaking of being conservative, I fully believe that conservative's the way to go. That's the big thing out there now. People want surgery without looking like they had surgery. Mm-hmm. And even cosmetics, fillers, Botox, they want to look natural, but they want to look younger.
Yeah. You just want to look like the better version of yourself.
Right.
And I do welcome patients that bring me wish pictures. And then I try to say realistically, is this achievable for you or not, right? Because we're all very different. So if you are petite like me, 5 feet tall, and you bring me a picture of a 6-foot model, right? It's going to be a little bit different. But if you bring me somebody that's similar in size and shape, then we can talk about how things fit you in a realistic realm. When it comes to facial aesthetics, which I also do a lot of, I always ask about what are their goals? What are the things on their face? We look at mirrors together. I have them point out to me. One of the hardest questions, at least for me, is when people come and tell me, Doc, what do I need?
Right.
Right? Andy, what do I need?
It's whatever you want, but we got to be realistic about what you want. And that's just kind of what I say to my patients. I'm like, you tell me what your goals are, and I'll tell you what we can do to get as close to them as possible. But I'm also not afraid to say no to my patients, because if there's something that's not going to work well for them, I will say no, because they will regret it in the long run.
Yeah, I think that's really true. When I see doctors trying to tailor to patients' wishes that are not within the realm of reality, then I think they're doing a person a disservice. And it happens a lot. People come in with an idea in mind, but then I have to tell them, like, to get you there, these are the steps. And sometimes I have, at times, let go of patients that I didn't think we were on the same wavelength. Like you said, the saying no. It's important. If somebody's telling you no, there's a reason why. And you maybe will find a better fit somewhere else. I definitely am not scared of doing that.
Right.
I just feel and know what can work well in my hands.
Mm-hmm.
And if I don't think I can deliver that result, then I will send someone to another surgeon or another cosmetic dermatologist, another great injector that will be able to get them what they want. Not all of us have the same aesthetics. I'm sure that if Andy and I look at the same person, we might see different things.
Right.
Right? And for me, it's important for that person to tell me, look, my eyes bother me or my lips bother me. And then I can tell them, this is what I think we can do to get you there.
Right. And then if I can't do it, I honestly am like, the best bang for your buck would probably be to have some type of plastic surgery. And I always try and get them set up with one of the plastic surgeons because at that point, it's out of my realm, right?
Yeah.
But definitely, best bang for their buck is what I try to explain to them. If you're going to get this done today, this is what you're going to see. But longevity, spending that money every 3-6 months, you'd be worth it getting a lower bleph or a facelift and something like that.
I told Andy earlier that I have this analogy I give all my patients when it comes to facial aesthetics. I tell them that their face is like a bed, that your bone structure is like the bed frame. And then you have your subcutaneous tissues and muscles, which are the mattress. And then your skin is the bedspread. And honestly, nobody cares what you've done to your mattress or bed frame or how much money you've thrown on there.
Yep.
If your bedspread is wrinkled, right?
That's what they're going to see.
That's what they're going to see.
And that's all they see.
Yeah. So the basics to me of facial aesthetics starts with your skincare routine, which Andy's going to tell us a lot about in the future episodes. And we're going to go into details of what she uses because everybody tells her skin is amazing, which it is. It's glowing. Patients ask me where my regimens are. So we'll go over some of that stuff in our future episodes.
And we'll give you the dirty deets of like what we actually feel like over the counter is worth it, what prescription medications, actual prescription products are worth it, our medical grade products. But again, like I said, our goal is just to give you the best bang for your buck that's actually going to do something for you.
Yeah. And we'll go down all those bedspread, like all the bed layers, right? And tell you what can affect each one of them because that's what you want. And that's why my consultations actually take a little bit of time. I do take 30 minutes to do a facial aesthetic consultation for any injectable patients that come because I want to look at faces together. We even have a 3D modeling machine that I can take your picture and mirror what it would be like if your whole face was like the right side of your face or your whole face was like the left side of your face. It's very awesome. If you haven't done that, you should do it.
Now, is that the Vectra?
The Vectra, yeah. Because we're all asymmetrical.
Right. And I don't think people understand that. But when you definitely look in the mirror, one side's going to be different than the other regardless. And then people try and get more asymmetry. But I think once they truly see what one side matches the other, they don't like it.
Right. Asymmetries are like normal. And our eyes drift sometimes to perfect lines. It's amazing that one of the techniques in plastic surgery to correct a visible scar is to make it more jagged.
Right.
Right? Is to like see it or reorient it in a different way than what our eyes are going to pick up. So we pick up these weird symmetries. There's a lot of research that says that the most beautiful faces have certain harmonizations to them.
Right.
But if we really did make you look exactly like you do on just one side, I don't think it would be more like robot look like.
And I tell my patients, I'm like, you are your own worst critic. You see yourself every day. You're that one in that mirror. So like for me, I take pictures of my patients on day 1. I see most of them back in 12 weeks because that's usually how long it takes to see change. And they are blown away by the change from day 1 to day 90 because they've been looking in the mirror every day and they only see that small change.
Yes. And even though I won't put necessarily all the stages of before and after in a book, for example, or put them out on the internet all the time, it's really important on the journey of a plastic surgery patient to have those landmarks. What do you look like post-operative day 1? What do you look like a month after surgery, 3 months, 6 months? Because we see ourselves every day, we don't notice those small changes.
Right.
And it's critical because our eyes play trick on us. And when you start a, let's say, skincare regimen, it takes at least those
90
6,
days.
8 weeks for you to be able to see any kind of change. And I will guarantee you that somebody else will see those changes in you before you see it in yourself.
Correct.